All right, hello everyone. Today I will take you through the salt and solubility lecture that we went through in class. And basically we're going to review some of the commonly used organic and inorganic salts and what effect they have on the overall solubility of the drug. So the objectives of the class are very simple. I want you to be able to identify water-soluble inorganic salts. I want you to be able to identify water-soluble and lipid-soluble organic salts. Then you should be able to explain the therapeutic advantages that can be achieved using those salts. I would like you to be able to see that sometimes salt formation can lead to unwanted drug interactions. And finally, as part of this conversation, we will briefly talk about partition coefficients, how they are determined, and how these correspond to solubility values. All right, so as we mentioned earlier, a salt is an ionic compound that is produced when an acid reacts with a base. And so the salt will usually consist of a positively charged cation and a negatively charged anion. So you guys are familiar with this concept, and we're simply applying that concept to drug molecules. So for instance, sodium hydroxide reacting with HCl is going to give us sodium chloride. This will exist as a salt form. And obviously you're going to have a water molecule here. Okay, so the same type of reaction can be accomplished using acidic or basic drug molecules. So penicillin V that you see here can be classified as an acidic drug, specifically because of the carboxylic acid moiety that you have. That's an ionizable group. So if you were to react penicillin V with potassium hydroxide, that will give rise to potassium penicillin V, usually called penicillin VK. In most institutional places, we'll call it penicillin VK. And so penicillin VK is the result of a reaction between penicillin V and potassium hydroxide. Okay. You have a similar example with thioridazine. And thioridazine is an antipsychotic drug, and it contains a basic tertiary amine. There's a basic tertiary amine here in thioridazine. When you react thioridazine with HCl, hydrochloric acid, you then form a salt that contains a quaternary ammonium, and this is a salt form that thioridazine is available in. Okay. Now, as you notice in both cases, there is a remaining ion that serves as a counter ion to the molecule that we started with. Okay. So it's very important to notice that although you see the ionized form of this compound here, it's not simply ionized, it is in a salt form with a counter ion. Okay, all right, so let's move into our analysis here. Now, when we deal with organic and inorganic salts, the term organic or inorganic does not really refer to the drug molecule itself. It rather refers to whatever entity we use to create the salt with. So by that I mean clonidine hydrochloride is an organic molecule. This is organic. All right, this is an organic molecule. Okay. The reason why this is called an inorganic salt is because there was reaction with HCl, which is inorganic. Okay, so the primary advantage of converting a drug molecule to an inorganic salt is that the inorganic salt is actually going to enhance a few things. Okay, one of the things that the inorganic salt is going to enhance is water solubility. Water solubility is going to increase the dissolution of the drug. Okay, and it's going to enhance solvation as well. So in a nutshell, when you synthesize inorganic salts, you are making more water soluble molecules. All right. In this particular example, we have clonidine, a medication that is used to manage hypertension. Morphine sulfate, which is an opioid drug, usually used for pain. Phenytoin can be used for seizures. And losartan potassium, which can be used for hypertension as well. Okay, so as we mentioned before, you have a salt that is formed between the drug molecule and an ion from the inorganic compound that was used to react with the drug molecule. Let's take a look at organic salts. Organic salts are interesting because they can be organic salts are interesting because they can be both be water soluble or lipid soluble. So in this slide, we are looking at water soluble organic salts, and similar to what we saw earlier, water soluble organic salt are going to increase water solubility. And usually you either have a sugar, you have a sugar analog that can be used. Sometimes you have glycolysis intermediates that are used, and the idea is that those compounds that are used to form salts with have multiple hydrophilic functional groups. For instance, in the case of sulfisoxazole diolamine, you have hydroxyl group here, you have the amine group here. All these are hydrophilic. Okay, so these groups here are going to increase water solubility. Remember, we talked about glycolysis intermediate. So in the case of the lactate here, you have this group here and this group here that are going to be hydrophilic, and so on and so forth, Okay, now sulfisoxazole is a good example of how water-soluble organic salts can produce enhanced water solubility. So the sulfisoxazole diolamine can be solubilized at physiological pH. However, sulfisoxazole sodium by itself is going to require a much more basic pH to be solubilized. Now, this particular drug is actually used, compounded as a salt to be used in eye drops. So the advantage of converting this to a salt is that you can actually have solubility at more of a physiological pH. as opposed to a basic pH. Now, if you were to inject if you were to have a basic pH in the eyes, for instance, that will produce a burning or a stinging sensation. Okay, so this preparation as a salt is much better because you want to use this as an eye drop. All right, so that's one of the reasons why those compounds are marketed as a salt. Okay, now let me see here. All right, so let's move on to the organic salts here. Now, when we talk about lipid soluble organic salts, the same reasoning that we use for the water soluble organic salts apply here as well. You have a bulkier group. Here you have the presence of the phenyl groups here. Yes, you do have the amines at this position, but the contribution of the phenyl groups is going to supersede the contribution of these amines here. And so this penicillin benzathine is going to be more lipophilic than penicillin V on its own. Okay. Now, when you think about it, penicillin V is used to treat many different injections. Penicillin G benzathine is used to treat severe infections, and often you want it to administer as either IV, but when it's administered IV, it results in rapid elimination. So you have a severe infection, you want to make sure that you administer the drug and that it reaches circulation, but when it's administered IV, it results in rapid elimination. Okay, so one of the ways that we can increase the half-life of this drug is by administering it as a salt with the benzathine. Now, this is going to be more lipid soluble. So instead of administering this compound as IV, we can now inject it, we can now administer it as an intramuscular depot. And when you administer it as an intramuscular depot, it's going to slowly be released into the system. And now, instead of having a half-life that's about 4 to 6 hours, you basically double that half-life when you administer it as a salt of the benzathine. So that's a key therapeutic advantage here. You reduce the dosing frequency, and you also have reduced dosing frequency. And you also have a constant, slower release into the system. Okay. Now, there are other reasons why drugs are synthesized or drugs are formulated as salts. In the case of erythromycin stearate, erythromycin is actually acid labile and can undergo elimination. It can undergo degradation inside of the stomach. So inside of the stomach, when erythromycin is taken, the hydroxyl group at the 6th position can actually attack at the carbonyl at the 9th position. And that only happens if the drug is soluble. Now, when you formulate erythromycin as a lipid soluble organic salt, this drug is no longer soluble in the stomach. So if it's not soluble in the stomach, it's not going to be degraded by the acidic environment. So this drug is then processed from the stomach to the intestine, where it is actually absorbed into the system for activity. Okay, so let's look at the next slide here where I actually have the degradation mechanism here. As I mentioned, if you were to administer erythromycin on its own without the formation of the salt, it's going to be very water soluble, so it's going to be soluble in the environment of the stomach. Okay, and because it's going to be soluble in the environment of the stomach, the acidic condition of the stomach is going to cause these degradation to take place. Okay, again, hydroxyl at the 6th position attacks carbonyl at the 9th carbonyl carbon at the 9th position, and in the presence of acid, then you have the formation of a hemiketal. Again, the acidic environment leads to the formation of a ketal, and you lose drug activity. So that's one of the reasons why erythromycin is actually formulated as a lipid-soluble salt. Now, sometimes drug interactions, sometimes the formation of the salt is not beneficial, and sometimes the formation of the salt is not intentional. You have, for instance, an interaction that can happen when you have the beta-lactam antibiotic that's called cefepime, and cefepime inhibits bacterial cell wall. So it's used in hospitals to treat conditions such as endocarditis. It's also used to treat pneumonia, among other conditions. However, when it's used to treat for pneumonia, for instance, it is used as a combination therapy. Combination therapy with aminoglycosides such as gentamicin, which is an aminoglycoside. Okay, so when these two drugs are going to be administered, if they are administered together, as you can see, you have the carboxylic acid moiety of the cefepime can actually react with all these amines on the gentamicin, and they can form a salt. Remember, we mentioned that the salts are ionic compounds that are formed from a reaction of an acid and a base. Okay, so we have to be very careful when we have acidic drugs and basic drugs that have to be used in combination. Okay, the combination is beneficial because you decrease resistance, you increase the survival of the patients. However, it has to be done strategically. You cannot mix those two in an IV bag. Okay, you have to make sure that these drugs are actually separated by space and time when you administer them. Otherwise, you're going to have a precipitate that forms either in the IV lines, in the bag, or worst case scenario, in the patients. Okay, so the concept of organic salts doesn't simply occur outside of doesn't simply occur as a strategy for scientists to make the drug more soluble. It can also lead to drug interactions if we are not careful how those drugs are administered. Another drug that can also cause this type of interaction is heparin. The reason why heparin cannot be administered with a lot of other compounds is heparin has acidic moieties, and if heparin, which is an uh, antithrombic drug, so if you administer heparin, an antithrombotic drug, administer that drug with diazepam, amiodarone that is used to treat heart condition, promethazine is an antiemetic, or haloperidol, which is an antipsychotic. The administration of heparin with any of these drugs here is going to lead to the formation of a salt. Okay, so this is a concept that is really important to know. You do not want to mix those drugs together because organic salts can actually lead to drug interactions. All right, so let's talk about partition coefficient for just a little bit here. So the partition coefficient of a drug is defined as the ratio of solubility of the drug in organic solvent to the solubility of the same drug in aqueous environment. So let me write that down here for you. Sorry about that. So you have a ratio of solubility. We're going to call it P. Concentration of the drug in lipid environment over concentration of the drug in aqueous environment. Okay, and you can take the log of P of that, and that's going to be the log of concentration of drug in lipid environment in aqueous environment. Okay. All right. So often these values have to be calculated. They have to be calculated at an aqueous pH in which the drug molecule is primarily ionized. Okay. So let me give you a few compounds here, for instance. So first of all, let's talk about this. Let's talk about what this means. So it's the ratio of the drug in lipid environment to the ratio of the drug in aqueous environment. Now, if the drug is lipid soluble, if the drug is really lipid soluble, then this ratio here, you're going to have more of the drug in lipid than you have in an aqueous environment. So the value of P increases. Value of P increases when lipophilicity increases. And the same for the log of P. Increases with increasing lipophilicity. Okay. All right. So this is good to know. This is good to know. So when you're looking at a drug molecule, there's two ways you can determine whether another drug is lipophilic or hydrophilic. Obviously, you can look at the different functional groups. You have functional groups like the carboxylic acid groups, carboxylic acids. You have, we've talked about the beta dicarbonyl groups, for instance. We've talked about sulfonamides. We've talked about phenyl groups. Obviously, all the different amines, primary, secondary amines, tertiary amines, the amides, thiol groups. So these groups are usually, these are hydrophilic functional groups. These are hydrophilic functional groups. So when you look at a drug molecule that has hydrophilic functional groups, most of them hydrophilic functional groups, you can determine that the drug is going to be a hydrophilic drug. But what happens when instead of the hydrophilic functional groups, you have bulkier groups such as, I'm going to write over here, just have a regular alkyl groups here, and you can build those chains up. You can have more aliphatic chains here. You can have alicyclic rings. You can have esters. And depending on how bulky the R2 and R1 group are, these are usually going to be hydrophobic. So you look at a drug molecule, if a drug molecule has more hydrophobic groups, then you can deduct it's probably going to be more lipid soluble. If it has more hydrophilic groups, you can deduct it's probably going to be more water soluble. However, if you actually have the log of P value, the higher the log of P, the more lipophilic the drug is going to be. So the log of P gives you an actual scientific value to determine whether a drug is going to be more or less lipophilic. All right, as we've mentioned before, salt formation is going to help us with solubility. So in this case, for instance, when you have a compound such as clonidine hydrochloride, when you have clonidine hydrochloride, you are going to make this compound more water soluble. So this is going to be more water soluble. Aqueous environment. Morphine sulfate. This is an inorganic salt. Inorganic salt gives you water solubility. Okay. When you have organic salts, if the organic salt contain a lot of hydrophilic groups, such as with ketorolac tromethamine, these are actually going to be water-soluble organic salts. Water-soluble organic salt. If the organic salt, as we saw before with penicillin benzenetine, has bulkier functional groups that are more hydrophobic, you are going to end up with lipid-soluble organic salts. The advantage of this is, as we mentioned before, you can administer this as an IM depot, where you have a slower release of the drug and you increase the half-life of the drug by reducing the elimination. Now, another way to increase the solubility or to optimize the solubility of the drug is by the use of esters. So you can esterify a molecule and either increase the water solubility or increase the lipid solubility of these particular esters. Okay, so oftentimes when you synthesize a drug as an ester, what you're doing is you're synthesizing that drug as a prodrug. So a prodrug basically means the drug has to be converted to, the drug is administered inactive. So prodrug is administered inactive and has to go through conversion to reach its active form. Okay, sometimes it's not totally inactive, sometimes it's weakly active. But the concept is it has to be converted once it gets inside of the system. It has to undergo metabolic activation. Okay, so let's talk a little bit about water-soluble esters. If you're going to esterify a molecule and make it water-soluble, what you want to do is you want to use phosphates or succinates. Phosphates or succinates are really good groups where you esterify a molecule to make it more water-soluble. If you want to make it more lipid-soluble, then you have to consider the type of groups that you're going to use for that. So the more lipophilic substituents you have in your ester, the more lipid soluble this is going to be. So for instance, if you were using esters of benzoic acid, or actually you can even use bulkier molecules. The bulkier the substituent, the more lipid soluble it's going to be. And these will give you lipid soluble esters. Another strategy to alter solubility is to actually change the type of functional groups that you have. So you actually have to do some synthetic reactions to alter the functional groups. So for instance, triamcinolone can be made into a much more lipid soluble form by substituting the hydroxyl at the 17 and the 16 position. And this is going to give you a more lipid soluble form of it. On the other hand, ampicillin can be made more water soluble simply by converting this phenyl group here, transforming it into a converting the phenyl group into a phenol. So a medication such as ampicillin, again, we're talking about the beta-lactam antibiotic. This particular drug can be used for upper respiratory tract infection, upper respiratory tract infection. You can also use them for urinary tract infection. And ampicillin is a molecule that is actually going to be a Zwitter ion. Zwitter ion, you have both negative and positive charge. It's an amphoteric compound. It has both the carboxylic acid and the primary amine. So when it's ionized, it's going to exist as a Zwitter ion. So it has both positive and negative charge in it, which actually result in an overall net charge of 0. So sometimes this molecule will have adequate water solubility. Other times it doesn't have that good of a water solubility, and it has a decrease in absorption. So it was observed that when you actually convert the phenyl group into a phenol, you actually, because of the hydrogen bonding capability of the phenol, you actually increase the solubility, the oral absorption of the drug from 30 to 55% oral absorption. You move to 74 to 92% oral absorption. And basically the key attribute here is the possibility of hydrogen bond for the phenol. It increases the water solubility. Okay. Now, the last point that we'll look at is the influence of solubility on metabolism. Now, the role of metabolism is to convert drugs that are taken in the system and to make those drugs more hydrophilic so that they can be eliminated by the system. So the more lipophilic a drug is, the more likely it is to go through metabolism. So think about it this way: drugs are xenobiotics, right? So when they get in the system, they're looked at as foreign objects by your body. And the goal is to detoxify these foreign objects so they can be eliminated. Okay, so when a drug is lipid soluble, when it's mainly lipid soluble, it's going to undergo a lot of metabolic steps before it can be converted into a more hydrophilic version of it so it can be eliminated. If a drug, however, is already water soluble, the steps to metabolisms are much shorter. So overall, if you don't have to undergo a lot of metabolism, you have less chances or less risk of drug interaction. Okay, less risk of drug interaction. So drugs that have more lipophilicity are going to be increased lipophilicity. Lipophilicity is going to lead to increased metabolism. Is going to also lead to more plasma protein binding. Okay, so solubility has an effect on metabolism. The more hydrophilic, the less involved metabolism is. The more hydrophilic, the more steps you have in metabolism. So, quick summary of everything that we've mentioned here today. Water solubility has advantages. It's going to enhance the dissolution in the GI tract. And if it enhances the dissolution, it's going to increase the distribution drug is going to be more available. These are good for IV solutions, ophthalmic, otic solutions, also good for oral absorption. They require less metabolism, less plasma protein binding, as we've seen in the case of penicillin G. Sometimes it can also have shorter half-life because it's easily eliminated. Drugs that have higher lipid solubility have an advantage because they can actually pass through the lipid bilayer. They can cross a blood-brain barrier. They can be available for intramuscular administration. Also, subcutaneous injections can be done with these drugs that are more lipid soluble. You also have ointments and creams that can be formulated as ointment and creams. They also have a longer duration of action because sometimes they can bind to protein, to plasma proteins, and depending on how they are administered, if let's say they're administered as a depot, as we said earlier, they can be released slowly into the system. Okay, so this concludes our lecture on salts and solubility. I hope it was useful for you, and our next lecture is going to be on drug binding interactions. Thank you for your attention today.